Good afternoon and welcome. My name is James Kidd. I'm an employment partner at Mills & Reeve, and I'm joined by my colleagues Duncan Astle and Patrick Phipps. Duncan is what would you say, regulatory partner, Duncan? Would that be a?
Yeah. And if it doesn't fit neatly somewhere else, it comes to me.
Yes, I often ring you with some strange Duncan as issue type queries. We're really pleased that we're joined by Patrick Phipps, who is our director of our facilities, who's going to be able to share with you today details of actually what M&R is doing in relation to return to work. So what we're going to be doing today, well, first of all, we're going to be recording this and it will be available afterwards if you want to relive any of the action. I think that's what they say on any of those exciting programs. Please use the Q&A function to ask a question. Depending on timing, we may get to be able to look at some of the questions and hopefully answer them live. That can be difficult if we're in the midst of delivering the presentation, but we'll see what we can do. And there will be some polls as we go through. Okay, so what are we going to be doing? Today's going to be focused on a return to work. It's return to work in England, and it's return to work with a specific focus really on offices and from the employment and regulatory / health and safety experience. So me as an employment lawyer, Duncan as health and safety. And as I say, we're going to be bringing in Patrick to talk about what we, Mills & Reeve, are doing in terms of getting people back to work. So we're going to try and pick up what the issues are going to be for you guys who are employers dealing with the change in the focus that Boris announced the other day. So on that note, let's talk about what has changed. So Boris announced 17th July, with effect from the 1st of August, it's no longer basically stay at home, work from home if you can, to being actually putting all the onus on individuals and more particularly on employers to say, let's get people back to working from the office. So still working, but working from the office, and get people out of furlough if we can, with all the other things that are being opened up. So Mills & Reeve, we have the majority of us, and Patrick will cover how many haven't been, the majority of us have been working from home now for 4 months or so, and that's worked very well. And we are looking at how we would go back, or some of us would go back into the office to see if that's possible. Boris has set out that people can use public transport more easily, but there are issues and consequences of us doing so. Perhaps stating the bleeding obvious as to why we are doing this, or why Boris is suggesting this. It's not just for everyone to be seeing their colleagues, not just on Zoom calls such as this, but actually, and instead in offices, but it's all of those other benefits which will be gained as a result of people being in city centres and being around their normal places of work, as we know. So government guidance changed. It's all very short notice, with effect from the 1st of August. Let's get people back to work. But actually, can you? How do we? And what's going to happen in the future? So let's have a look at some of the health and safety issues. Duncan, so should employers be revising their risk assessments?
Well, I think there is a legal obligation under the Health and Safety at Work Act to review your risk assessment whenever there is reason to believe it is no longer valid. And so as we progress over the next weeks and months, we're going to have to constantly, I think, keep that under review as we learn more and more about the coronavirus and the effects of people returning to the workplace and you know, obviously moving to this new phase. So I think that methodology, the Health and Safety at Work Act, is going to really help you during this process, because I think it's probably important just to say that the reason we are moving into this phase is that the community, the rates of community infection are now low enough for people to return to work. Obviously, lockdown came along. That was partly in a clear view that the NHS was at risk of being overwhelmed. There was no mitigation in place anywhere in terms of preventing transmission from one person to another, and lockdown was, you know, in effect a necessary evil to buy time and get us into a place. But I think in terms of returning to work, it's important to think of it as mitigation rather than elimination. So there's no way that I think you're going to have, and I think it's slightly misleading, the words that the government are using, a COVID secure workplace. Inevitably, you know, going to the shops, going to the pub, going to work, you are going to come into contact with other people, even remaining socially distant. There is a risk of transmission, and therefore what the government is asking you to do, what the Health and Safety Work Act requires you to do, is to reduce that risk of transmission to as low a level as is reasonably practicable. It's not about removing it entirely. That's not possible. That's everyone staying at home. And it'd be interesting to see whether the guidance changes, the extent to which there are local lockdowns, the extent to which, you know, people do retreat from the workplace in the autumn if rates go up significantly. And obviously one of the things that you'll need to include in your risk assessment is what do you do if somebody in the workplace gets a positive diagnosis of COVID, and what's your immediate response to that. You know, we've all seen today's announcement that the isolation period for anyone who gets the disease is now increased to 10 days.
And your response shouldn't be, I would suggest, to say everybody who's had any contact with that person, worked with them, to send them all home. I think the test and trace application should be a bit more analytical than that.
Yes. So you're right. I mean, the test and trace process is looking at people you have effectively had prolonged contact with at less than 2 meters, isn't it? So at the moment, the evidence is the primary method of transmission is either contact or droplets, and therefore it's close contact. It's theoretically possible for the virus to remain active in an aerosol, according to the World Health Organization, but as yet they are not saying that that is a likely route of transmission, and therefore the 2 meters is still the primary, and, you know, say cleaning arrangements, etc., is the primary defense, the primary mitigation measure.
Okay, so returning to work from the 1st of August, reducing, not removing, I think is the key point, the risks, and we'll come on to how we share that with employees. Travel to work, so a lot of people are going to be on trains with masks. Duncan, what's the issues arising from that?
So it's always been clear that you as an employer are not responsible for people until they arrive at work. You know, it is not reasonably practicable for you to manage to determine what is or is not a safe way of someone to get to work. The government are very clear that it is safe to use public transport. You should use a mask while doing so. But you know, in a sense, it's not your concern from a health and safety law point of view how people get to work. I appreciate, and you might have a view on this, James, as that's a lot easier said than done, and certainly, you know, Mills and Reeve aren't expecting all of our people in London to necessarily want to jump on a train, jump on a tube, and go into our London office. So, you know, I think it's, in practical terms, most employers will be taking into consideration how people get to work as to the extent to which they are requiring people to attend work, even though it's not strictly, you know, their concern from a legal point of view.
Yeah, absolutely, I'd agree with that, and we'll come on later to what we call the reluctant returners, those people who want to come back but don't really want to come back yet, perhaps, or at all. In terms of consultation, so my take on this is that in engaging with the workforce to get them to return to whatever workspace you're in, you should be talking to your health and safety reps, assuming you've got some, and you should have some under the Health and Safety Work Act. Duncan, is that right?
Yes, so if it's unionised, then there will be, the union will sort of elect the representatives. Otherwise, you need to put together some representatives from your workforce. And you may need both.
Yeah, and talking to them about what you've done, how much you've spent on hand gel, all of your one-way systems, all that stuff, And from my take, it's about reassurance, isn't it? It's about saying, we've done all these things. Is there anything else that you think that we should have done?
Well, I think there's two parts to it. In the you're right. Again, legally, you have to consult with your employees, have a mechanism for doing that. And I think it's a good source to understand what people are concerned about, what's practicable, what you can do, what might not work. So I'd see that first part as a sounding board. Get some views from people. There is then a second part, in my view, in that once you've created your risk assessment, you've done your workplace risk assessment, the guidance from the government is very clear that you should share the outcome of that with your employees. And I can't remember, I think it's over 50 employees, you should be publishing that on your website. So that it is available to all employees. But then in a sense, that's the second step. Consultation isn't achieved by sharing your risk assessment. Consultation needs to be meaningful and as part and parcel of you producing your risk assessment.
Agreed. Okay. I think it's about time we brought Patrick in and said, great reaction, Patrick.
Okay.
Tell us about what we've been doing for our own risk assessment, Patrick.
Okay, so I think it's really important that Duncan's points there about your current risk or your risk assessment pre-COVID is not null and void. It's still current. It still needs to be adhered to. I think the COVID risk assessment is really a supplement to that. So it's taking in and mitigating the risk of this current crisis we're going through. We've done a lot of consultation through the firm. So we have an incident management team that was set up well before COVID even came in, but for this type of event, which contains a broad cross-section of functions and business services. And we've met daily from virtually sort of mid-Feb when this started to sort of evolve, to look at what do we do, how do we do things, how do we communicate to our teams, what do we do for communication purposes to the whole of the business. And from the beginning of March, when lockdown commenced, we had, just to put it in context, I think it was 960 people went from working in an office to working from home overnight, and that in itself caused a few issues. But we did keep on site all our key business services functions. So facilities teams, a number were furloughed, but we did keep a core of people on site all the time. So they've been working throughout this process from the offices, and as quite right, so helped set up the whole of the COVID mitigation process we put into place. So we looked at. We didn't want to disregard our current health and safety risk assessment. What we have done is now created a purely COVID-focused risk assessment that sits alongside that. That can be found if anybody's interested in the detail, because it is quite a detailed document. It's on our internet homepage at the very bottom, the bottom bar across there, and entitled snappily as the COVID risk assessment. So if you want more detail, by all means, you can get into that and have a look at it, and please, use it for reference. And if you need it for your own offices, then please feel free to plagiarise away if you like. I'm allowed to say that, James. Am I allowed to say that? No. Okay. Don't rob it, but you can it'll give you a good steer, which is what
you can do, rather belatedly, but the Health and Safety Executive have now published an example COVID risk.
Yes, they have got a template on site.
So they've provided a template and some guidance on some of the approach. Yeah. So that might be the one to plagiarise, because it's difficult.
Yes, because it's
criticise you if you've used theirs.
But I think what ours does do, if you have a look at it on our website, because it's open to everybody on that goes onto our website, is it gives you all the areas that we have considered and the actions we've taken to mitigate the risk of spread of the COVID virus in our offices. Duncan's right. We haven't in there considered anything about travelling to and from work. We haven't put in there things like face coverings must be worn at work, because I don't think a lot of people don't want to, but again, we've advised that if people want to do it, that's fine, but we're not enforcing it. There's some of the detail we put in this. Sorry, go on, just James.
Just on that point, we three have discussed this, so I think it's worth just repeating apart from Duncan's distracted slightly.
Well, I was trying to see if I'd got my face mask. I was going to put it on while we were...
Live demonstration of man putting on face masks. Brilliant. I'm sure the audience will appreciate that, Duncan. So we've discussed this. Let's just go over this. So the government guidance is if I go into a shop, I have to wear a face mask whilst in the shop. Why is it different when I'm in the office?
Shall I start with that one?
Yes,
yeah, I mean, let's put it this way. The government, what we're talking about is government guidance. So it's only that, it's guidance. You should have regard to it. You don't necessarily need to follow it. I think the main difference would be that if you're going into a shop, you're likely to be there for a short period. In the workplace, you're going to be there for a much longer period. But in essence, it's doing the same job, isn't it? Whether you're wearing it in a shop or you're wearing it in an office. So it doesn't necessarily change it from a risk assessment, but in terms of effectiveness, but from a what is reasonably practicable. You may determine that it is reasonably practicable to wear one for a short period while you're in a shop. It's not reasonably practicable to require all of your employees to wear them all day whilst in the workplace. And Patrick, obviously you talked about if you start to multiply up the number of face coverings you might need during the course of a day, and to provide to not 960 but however many 100 people might be in the workplace. It's not necessarily a reasonably practicable measure, even though it might physically reduce the risk of transmission.
Yeah, okay, that makes sense. Yeah.
And there was an interesting debate on the radio this morning that I heard talking around face masks in schools. So the department aren't requiring children to wear face masks whilst at school when they return in September. Some schools are making it a compulsory part of the uniform. And there was an interesting debate between teachers really on some thought that was just not something you should be asking children to do whilst in class, that it was really unfair, it would have a detrimental impact on the education they were going to receive, and other teachers who were concerned about the ability to keep children 2 meters apart, and therefore it was a reasonable measure to ask them to whilst in class, obviously, to wear it. I mean, my experience to date is that putting it on for a short period whilst you were walking around the office, going to the toilet, making yourself a coffee, etc., and taking it off when you sat down again, that's probably how I'll behave in an office. That's how I behaved yesterday when I was in the office.
Yeah, that's it. So, okay. So face mask covered. Okay. So I guess going back to the risk assessment, there is a lot of detail in it, and there's a lot of thought needs to go behind it. As for consultation, we consulted with both the health and safety manager we have as the business, plus the facilities teams on site, and a number of people that were working in the office, so admin assistants that would be in the office on a regular basis throughout that period to help us devise and look at what do we need to do, what do we need to put into place. We used the government guidelines to some extent to form some of the areas we looked at, and the considerations we took into consideration for the risk assessment. And what we've done is when we come to communication, the team, what we did do, and the incident management team have been sending out at least, well, it's gone to 3 days a week now. It was every day of the week when lockdown was in its full prime. 3 days a week now, the whole firm gets a communication on an update of what we're doing, how we're doing stuff, how the business is doing, as well as what we're doing around COVID and return to work. That's because people are very interested. The risk assessment has been well publicised through that. It's on our intranet site live as well. We've used it as information in a briefing and part of the briefing pack for the pilot that we're operating, which we'll go into in a bit more detail later on. And we've also, because we've done that, we've also done a return to work guide for people as well. So rather than just leave it as here's the risk assessment, read that, we've actually done because we have 6 offices and 6 varying ways of operating in some of those offices as well. So they're different configurations. Some are multi-let buildings, some are owned just by Mills and Reeve or occupied by just Mills and Reeve. So they all have specific issues that we had to address in a return to work guide or returning to the office guide, which we've done again and publicised those to each of those offices, so they have their own guide to what can I expect if I come back into the office, what do you need me to do, what PPE is going to be available, what restrictions are there going to be, that type of thing. And it's gone down very well. We also did a walk-through video. So again, as part of that communication process around the things we've done to mitigate COVID spread and keep social distancing in the offices, we have compiled a video that was literally done on a phone, so it doesn't have to be anything technical, but somebody walking into the office from the front door and taking them on a journey right the way through to their desk, back from the desk to the tea point, looking at all the aspects of what we put into place to mitigate, I guess, spread of COVID virus in the office. So we've done quite a lot of work, and some of the areas we've taken into account, cleaning, we've stepped up cleaning, so we've done a lot of work around additional cleaning, stepped up janitorial services throughout the day to make sure all touch points and lift buttons and toilet areas are cleaned thoroughly on a regular basis throughout the day. We've restricted access to lifts. We've looked at the signage around our buildings. Where we have limited access via stairs, it's almost a one-way system up. If you've got two stairwells, one is for up, one is for down. We've done a lot of stuff in there, but it is in the risk assessment. So I'd advise you to visit the website, have a look at that, and actually have a look at what we put in there, because there's a lot of things to consider. Absolutely. But the communication point is key. And I think we've had some really positive feedback. And certainly through the pilot, which we will get onto later on, the feedback's been that the office feels really clean, really safe, and I feel really comfortable. So I think we've done a pretty good job with what we've done.
Okay, thanks, Patrick. Let's do a poll. Let's get the audience interaction right. So currently there's 105 of you. So this is a question about preparing for return to work. This is what we're talking about. Will you be going back into the office? Here we go, people. The poll is open. Please vote. So this is just about you. So 83% of you have voted so far. I think that's bad. Oh, some people are still thinking about it. It's a binary decision, people. I'm going to call that 88 of you have voted. So, wow, 70% of you, no, not going back into the office in August.
That's fine. I think, James, there is still a lot of anxiety out there. So there was a poll came out, I think, an LBC poll today, wasn't there, that there's still a lot of people that don't believe the government guidance or don't believe the guidance is right. Certainly for returning to schools and returning to office working. So I think there's still a lot of anxiety, and to be fair, there is in our business as well. So, but I guess it's what we can do to mitigate that and actually get people coming into the office and seeing what it really is like. Because until you try it, you don't know.
Agreed. Katie, yeah, you never left the office; you just stayed in. So you could have said, I'll be in the office in August anyway. The poll that Patrick is referring to is the King's College London and Mori survey, which said, our survey said, add your own sound effect there, 52% do not trust the government advice on whether to return. 45% said they generally trust the guidance. So more than half are uncomfortable about going back in, which I think is quite interesting. I might do the second poll now as well, around concerns around preparing for a return. So some more questions to answer here. Tick the one that you feel most appropriate towards your feelings. A bit more thinking required here rather than just yes or no. Katie, I'm guessing yours will be, I will feel comfortable to work in the office every day, given you never left. But I'm assuming that. While people are doing that, Duncan, can you look at the first Q&A SB and see if you had a view on that?
Yeah, so we've been...
Let's do it in a minute.
Okay.
Let me finish the poll.
I've got thoughts on the first two, James.
Excellent. I'll come to those. 89%. % of you have voted. I'm going to end that and share the results. So the majority, but not by much, feel comfortable to work in the office some days each week. Funny enough, I think Friday is going to be a day when not many people want to work in the office. much as, yeah, London will be a wasteland, won't it, as it tended to be.
It was last Friday on our poll, on our pilot, sorry.
Yeah.
Not a person, but anyway.
Only 9% of you will feel comfortable to work in the office every day. That's got to be for a mixture of reasons, I'm guessing, but that's quite interesting. So before we move on then to look at managing return to work, we have a question from SB. Test and trace, if an employee gets an NHS notification in the workplace, they tell the manager for precaution. Can we tell those who they may have had contact with, that employee, to come into the office until further notice? So I read that and tried to change the wording, but Duncan, do you have a view on that? Can we tell people?
I mean, can we tell people? I mean, that's a Data Protection Act issue, isn't it? That someone's shared with you information that relates to their health. Can you share it with others? I'm not a data protection lawyer, so I can't say yes, but I would expect that it would be in terms of ensuring the health, safety, and welfare of others, that there would be a legitimate reason for passing on that information. Obviously the sensible thing would be to explain in your policy, and explain to people who are coming in the office that this is what you would be doing, and listen to an individual if they had serious concerns about you sharing that fact with others. I think there is a sort of follow-on point from it, though, is it necessary to tell them? So I mentioned it earlier, is that your risk assessment should also include a sort of plan for what are you going to do if someone who has been working in the office contracts COVID-19. What's your response to that? The test and trace scheme has a set of criteria. That would be your starting point to decide whether you're comfortable with, effectively you're going to contact and ask to isolate anyone who has, met the criteria. But they would presumably be getting a call from the NHS test and trace team anyway. So.
I think there's going to be a good webinar by our tech guy, Jack Binder. Jack Binder is doing a webinar which covers this in a bit more detail, the track and trace. And
that's on the 5th of August, Patrick. Nicely done there. Nice link. Okay. I was going to mention that. So yeah, he's going to cover that, and I'll cover the other webinar at the end. Let's move on, because I'm conscious of time. So managing return to work, how do we engage with staff? I think the answer to that in short is well. Much like Patrick is talking about how we've done daily briefings to our staff, I don't think there is a downside really in being upfront and transparent with staff about what you're doing to make sure that the workplace is COVID secure, and therefore what you've done and why you want people to come back. So if everyone is actually working from home and it's fine, that's great. And you might say, given the poll results, we're not actually ready for this. And you don't, just because the government says they would like people to go back from the 1st of August, that's not the law. That's not compulsory. So you might say, we're not going to do that. We might have a rota system coming back. There are various ways of dealing with that. To my mind, this is about talking to your employees and saying, we'd like to have people coming back, and then engaging with them. And the issue when you engage with them is that's going to flag up a number of different issues. About some people are going to be nervous, some people are going to be unwilling, and some people are going to be willing. And it's dealing with the nervous people and providing the reassurance, which is, I think, key here. We've been talking about that. For the unwilling people, are you going to start disciplining people for not coming back, to refuse to come back, the reluctant returner, as I dub them? I think that's an interesting message, and might destroy your culture if you do that, because they might have good reasons, or what they perceive to be good reasons. So actually working with them, maybe they take some holiday, maybe they take some unpaid leave, maybe you can accommodate them still working from home if at all possible. Various ways of looking at that, rather than just immediately going, I want you in the office on Monday. So I think that engaging the staff is crucial to understand people's needs and work with them. Anything did you want to say on that, on Duncan, on that?
Well, I wonder if that's a good time to pick up one of the other questions that has been asked, is what would the position on excluding certain people from the workplace on the basis they may have a higher risk of contracting COVID-19, e.g. those who live with a key worker, or presumably all the people who are clinically vulnerable themselves. And I think this is, I've got two thoughts on that. Is one, I'm sure it's just typing it in a rush, but the risk of contracting the disease appears to be the same for anyone. The problem is the consequences for a number of people do appear to be much more severe, and there are a number of sort of things, obviously underlying health conditions, those who are classed as vulnerable or clinically vulnerable. There's increasing evidence that people who are black or from certain ethnic backgrounds have an increased risk of death from contracting the disease. Bangladeshis seem to be particularly hard hit by it, whether that's genetic or whether that's as a result of poverty, related other comorbidities, etc. When no one's quite clear yet, but there will definitely be people for whom the consequences of the contracting COVID-19 are significant. Or likely to be more significant than for others. Age, obesity also adding into there, and therefore you as part of your risk assessment, you might like to consider whether there are people who effectively you need to make reasonable adjustments for, and for them to continue to work at home. Whereas you might have someone without those vulnerabilities if they weren't living with somebody else. Then you might allow them back in. In terms of then, if you've got someone who is at a particular risk of bringing the virus in, I think is perhaps one of the points behind the question. Is I think that's really interesting, because actually there isn't a terribly high, apart from sort of one or two hospitals where there's been an outbreak. There doesn't appear to be a great deal of evidence of transmission of COVID from patient to medic, for example. And so, just because you're living with someone who perhaps works in a hospital environment, for example, as a key worker, there isn't necessarily any evidence at the moment that they're at greater risk of contracting the disease, other than one or two workplace outbreaks, which is the same for abattoirs and farms, seem to be the other areas, and that actually it seems to be the result of a lack of social distancing rather than actively working with people with COVID. It seems that PPE works.
Okay, thank you, Duncan. Appreciate it. I'm just going to briefly mention FFS. Don't think about what that's also abbreviated to mean. The flexible furlough scheme is there to help people get back. So government's opened up various different businesses, sectors, etc. So if you were furloughing employees, you can bring them back for parts of the week. You pay them as normal for the days that they work. They get the benefit of the job retention scheme grant for those days that they don't work, and are paid up to the cap for those days that they're still on furlough. I hear it's working. It's difficult to get numbers on that at the moment, but just bear in mind, obviously, the furlough scheme, the job retention scheme, is going to come to an end, and there are no indications at all that that's going to be extended. So it is going to come to an end at the end of October, and the employer is going to be increasingly paying, with effect from the 1st of October, more of the grant. I can get into details of that later if need to be. I'd like to instead ask Patrick to talk about our pilot.
Yeah, okay. So again, I think there was a question come up on the Q&A around, would you do a phased return to work then, 25, 30, 50%, whichever. We've been debating that with the incident management team partnership and other business service heads around what does that look like. And to be fair, we're not in a place as a business where we want to force people to come back to work. We're working quite effectively from home, which is great. Some businesses might struggle with that, but certainly in our instance, we've been pretty successful with it. Some people are actually happy doing what they want and want to stay at home. Some people are still anxious about coming into the office and want to stay at home. We've got a couple, from your point previously, the flexible furlough scheme, where we've got a couple of people that are really anxious, have been on furlough because they were shielding or anxious about coming into work, so they were furloughed, are now coming back part-time to have a, just to ease themselves back into the office. But there is a point in time where the office isn't going to be dead, so we do need to have people back in the office. We're a client-facing business, as I guess most people out there on this webinar are as well, and you need to have that interaction with your teams, so for both collaboration and building business. So there is a time where we need to encourage people to come back, but how you do that is a difficult question to answer at the moment. We've taken the option of doing a pilot, which was purely voluntary. So we sort of went out to the whole team in one of our update emails from the managing partner, floating the idea that we were looking at a pilot scheme, more detail to follow. We worked up a briefing document, which we put together to say with a Microsoft survey, which we went out to the whole of the business with that and a briefing document saying this is what it's going to entail. We're going to do it over 7 days, so 7 working days that is. So we did Thursday, Friday, then Monday to Friday this week. Purely voluntary. So again, we really stress we're not forcing anybody to come back in, but it would be great for people to come and experience, I guess, a COVID secure office environment and give us your feedback. So we very much sold it in that way. The hope is that the volunteers that are coming in, whether it be 1 day a week, 1 day in that period, or 7 days in that period, we've let them choose that as well. We're hoping that the feedback we're getting so far, which is really positive about the offices are clean, they are safe, we feel pretty much secure, we are socially distanced, all the great things that we've tried to achieve with the risk assessment and mitigation things we put into place are working. So we want those people to talk to their teammates as well around, actually it's okay, the office is all right. So we had, I think it was 141 responses. We did cap the number of people we would allow back into the office at slightly higher than that. So for instance, our office occupancy under social distancing has reduced down to about anywhere between 30 and 40% of the current desk space in our offices. We actually then capped the pilot at 20% of that. So we didn't want a mad rush back into the office or too many people back in. We just wanted to ease people back into it. And of that 141 people, each day of the test we've had on average, well, sort of lowest I think has been 98 people across 6 offices. The highest has been 140 something, 141 across that office. And that 141 doesn't include the facilities teams or the admin support that's been on site all the way through as well. So, and as I say, it's worked really well. And because we did it as a purely voluntary, I think we got the right people willing to come back, and we've asked them to test things like public transport as well. So how did you find getting into work? And we've then devised a survey, which if you're working just 1 day in those 7, you get the survey at the end of that day. If you're working 3 days, you get the survey at the end of the 3 days. So we get people to feed back in real time what their experience has been like. And we can then use that, I guess, their experiences, their feedback and suggestions to then start looking at, right, what's the next phase, which we believe in August will be, we open it up to everybody across the firm, not just volunteers. So anybody can come back into the office. But my view would be, my personal opinion is we won't get a great deal of response in August. Some holidays, still some anxiety, still some mistrust of public transport. So I think we will get more because word will spread. And then all we've done with our teams as a business is we've muted a date of 14th of September where, it won't be a pilot anymore and people would be encouraged to return to work. But again, working from home is still a possibility for people, so we're not forcing people back into the office.
So although we'll allow everybody to come back, we'll still be having a capped number of people.
Oh, absolutely, because yes, again, it's like the 30 to 40% of people, whilst social distancing is at 2 meters, is all we will be able to get into our offices.
If I'm being honest with myself, I can't see us all being back in and putting on seminars in the office. So instead of having Zoom calls, we'll have conferences. That won't happen this year, will it?
No, it won't happen this year at all. I think we're well after Christmas before we get to that stage. Well into the new year.
Okay, I'm going to move us on to preparing for what could go wrong, which is an interesting bit. So enforcement action claims from workers. I'll go to Duncan first, if that's all right.
Yeah, so I guess the way I'd start with this is say that it's been quite interesting watching the sort of narrative coming from both within the guidance from the government, also from the health and safety executive, and then the response of some of the politicians during health select committee meetings and things. So if I summarise it as this, the health and safety executive seem to have taken a fairly pragmatic approach and are realise that this is a sort of unprecedented time, and that provided employers are trying to do the right thing, they're doing the risk assessment, etc., etc., they're taking a fairly light touch approach, it seems. The government guidance is obviously, is becoming fairly pragmatic. It's not necessarily keeping up with the changes in the legislation, so there are some discrepancies. But generally, it's do what you can seems to be the message. The noise from several politicians, though, does seem very different. And the narrative changed a couple of months ago when there were a few outbreaks. And the health and safety executive, the chief executive of the health and safety executive, was being sort of challenged by at a select committee evidence session, being challenged by politicians saying, "Why haven't you closed businesses down?" And this was still pretty much during the pandemic. And whilst I think everyone gave a sort of reasonable margin of appreciation early on, to the government while they're trying to work out what to do, there's a lot more noise about how, in articles around how the government will get it wrong and that they were too late into lockdown, and calls for public inquiries and things. And so I think you do have to be prepared for a number of potential investigations by the health and safety executive, by litigation coming from people who do contract coronavirus in the workplace, and solicitors who are seeking to gather compensation. Obviously, it's going to be very difficult to determine where someone contracted the coronavirus. It's prevalent in the community. If they spent all day in a perfectly cleaned environment, maintaining socially distance in the office, etc., and then go down the pub on the way home and take no precautions, where are they more likely to contract it? So I think there's always going to be a difficulty in individual cases from demonstrating that you contracted it at work, and therefore there's any health and safety liability or civil liability, unless there's an outbreak. And so where you've got 70, 80 people all within one workplace contracting the disease, then that's where I think the time will be spent by the HSE to come and look at what procedures, what precautions were put in place, how you manage the outbreak from the first sort of symptoms, etc. And that's where there may well be claims for it may be easier to bring a claim for compensation if effectively. And I suppose this comes down to one of the points that we'd always say to people: doesn't matter how good your policy and procedure is, people have got to follow it. So in the office the other week, I thought, oh, I better walk down the stairs. So I walked to the other stairwell to go down the stairs to find someone running up the other way. So, however good your procedure is, if people aren't following it, then you've got a problem. So I think in general terms, reasonable amount of tolerance, but a large outbreak, etc., there may well be, some scrutiny of how you managed, how you put your procedures in place, and whether people followed them.
Mm.
Yeah, I'd agree with that. And it's also the point that the more you've done in terms of consulting with your health and safety reps, the more you've done in sharing your risk assessment, that bar an outbreak, the more likely it is you're going to be able to say it wasn't us, Gov, isn't it?
Mm-hmm.
Or you know, you did everything that was reasonably practicable.
Yeah.
There was no negligence.
Yeah.
That's almost a better legal way of putting it, really.
Excellent.
I think we've talked really about staff who are unable or unwilling to return. There is a question about would it be a redundancy situation if a person is unable to return because they're still looking after children or caring for their elderly parents. I don't see that actually giving rise to a redundancy situation. That isn't a reduced need of the employer for that work to be done. That's, you're going to need to agree terms with that individual, whether you can keep them on furlough still to the end of October, whether you want to put in place different arrangements.
Yeah.
I think you've touched
the concept of frustration of contracts still in existence as employment law.
It is. Frustration is incredibly hard unless somebody gets, to use common parlance, banged up in jail for a considerable term, which is a classic example of frustration. You can just say, sorry, you know, clearly you're unable to come to work. I'm frustrating your contract. I don't have to pay you any money. Frustration otherwise is very difficult.
That was the first case I won as a trainee. Was I got someone's paid out on an income protection insurance policy because their contract was frustrated because they got banged up in prison.
The law in action, ladies and gentlemen.
Indeed.
My first case in tribunal was defending a poor lady who'd been dismissed by a care home manager on the telephone completely unfairly, and due to my obviously devastating cross-examination, we won. It was an amazing victory. Possibly.
Down in annals, that one.
Yeah, exactly. We're all talking about coming back into the office and reducing those risks, as Duncan talks about. There is obviously going to be potentially another Leicester. There could be it could be a second wave leading to a national lockdown. I want to make a specific employment point. So at the moment, we've got the benefit of the furlough scheme, but I really don't think that's going to go beyond October. If we get outbreaks, either locally or nationally, beyond October, beyond the end of the scheme, I think we as employers need to prepare for what's going to happen from an employment perspective and from a health and safety perspective. But from an employment perspective, you've got to think, well, is the Chancellor going to suddenly pump more billions of pounds into a new or continuation of the current scheme? Seems reluctant to do so, but if it's a proper national lockdown, you've got to think to protect the economy, he might do so. If not, though, and I think you have to prepare for the worst, you need to be thinking about what you do in terms of employees' terms and conditions to prepare for that. So we all came to understand what the word furlough meant very rapidly. But years and years ago, we always used to have provisions called layoff in contracts of employment that allowed an employer to send the employee home without pay, save for some minor what are called guarantee payments, and avoid redundancy because where there is a shortage of work. And I think employers need to be thinking about preparing for this and going out to the employees and saying, will you agree to a variation to your contract to put in place the measures that you may, hopefully won't, but may need in the future. So that's from an employment perspective. Duncan, anything they should be doing from a health and safety perspective?
Well, I suppose the one thing just to flag, and I think there's a question around this as well, is that the guidance around home working is to think about all of the risks for employees. So if you're going to lay someone off, they're furloughed, whatever, do think about their welfare whilst they're working from home, whilst they're furloughed, etc. And it's not just about their physical welfare, but think about how you look after them, the stress that might put on them, etc. And so, sure, we can do a whole nother seminar about all the well-being support we've had as a firm. But I think I would think sort of more widely about the impact on that person as they remain an employee if they're not in the workplace.
Just picking up on that, from working from home, there are health and safety obligations. I'll dabble here, and Duncan, correct me if I go off beam here. But the employer has a duty, in the same way as somebody who years ago, should we say pre-COVID, put a flexible working request in to say, can I work from home? There's usually to make sure that they've got a safe environment. So that may be looking at an ergonomic risk assessment to ensure that
so James, if I can jump in there, so we've actually sent out to all our people working from home, so all everybody that is or has been, we've devised and sent our own a DSE assessment out to everybody to complete, to make sure that we could compile and I guess at least gather in the extent of issues that we've got with people working from home. You know, that you hear tales of woe of people working in a loft on a piece of worktop supported by two filing cabinets or whatever, or sitting.
That's great.
It sounds great. Sounds good. You have tales of people working off of an ironing board, not being able to sit properly, that type of thing. So, and I think, Duncan, I'm not sure whether you'd elaborate on it, but there is a duty of care. If we're condoning people working from home and actually are aware of issues like that, then as an employer we have, I guess we have an obligation to do something about that.
Yeah, so the HSE again have taken a pragmatic approach and said specifically around display screen equipment. So anyone using display screen equipment, you must undertake a display screen assessment. The HSE have said if someone's working from home temporarily, you don't need to do that. But if someone is permanently going to work from home, then you do. So at some point, so what we've done is sort of, a paper exercise in terms of, well, you do your own assessment using these tools and let us know if you've got any problems, such as the ironing board, which sounds to me like a really good sit-stand desk. And
love it.
Yeah.
Or you could multitask at the same time.
Yeah. So again, it's what's reasonably practical, but you do need to have a mind, especially as we go on into the longer, the longer as people are going to be spending much more time working from home. Then yes, you will need to start addressing, less than optimal. I mean, I have to say that's been my prime motivation for going into the office is done my back in, and therefore going in and using a stand-up desk in the office has been preferable to.
And I think one of the things we're doing at the moment is we've got a team working on what does the office or flexible working work look like in a year's time. So again, is that going to be, and I think surveys we've done with our teams, I think we've done 3 pulse surveys now around how people are finding lockdown and issues they've got. But I think that there is an overwhelming, as we saw on the survey that we did just now with the people on the webinar, overarching bent towards people want to work from home at least 2 to 3 days a week. And I think we're seeing that widely across our business as well. So our new office is not going to look anything like it does today, I don't think, in a year's time. But that will help shape how we do that and all the stuff that we've got to work back from now on to get to that point.
Yeah, and from looking at this for a particular client, the obligation is to provide the equipment to enable the person to do their job. So that would be the laptop and the screen potentially, but not necessarily the desk.
Well, I would say I'd sat at a desk. I don't know, Duncan, but I'd say you need to. Would we be liable for a claim for somebody that's had to sit on a stool for 8 hours a day because they haven't got a chair?
That depends. If they're disabled, then we might have a duty to provide an appropriate chair. Right. But if they're not disabled, I didn't think we needed to provide.
I think this way it comes to there's several areas where employment law and health and safety law don't quite sit ad idem, and so I think in terms of health and safety point, you have an obligation if they're permanently working from home to do the display screen assessment. And the assessment then will then feed into what they need, which might be a particular desk or chair. Whether you can supply that is down to, is it reasonably practicable for you as an employer to do so?
Yes.
So I think there's a sort of, it's not an absolute, we're entitled to this, that or the other from a health and safety point of view, but you have a duty to ensure, so far as reasonably practical, health, safety and welfare of your employees. So if they've only got an ironing board, you might think it's reasonably practical, certainly for Mills and Reeve, it's reasonably practical to buy them a desk.
Yeah, absolutely.
But it's a slippery slope to buying everybody a desk and a.
Oh, absolutely.
It is. Well, broadband was the one that I've had. Is people insisting that they wanted the firm to pay for their broadband
that they would be using anyway.
That wasn't a health and safety issue.
There are some tax breaks. If you work from home, you can recover something from your tax, £6 a week or something. I don't know the details. Martin Lewis covers this.
Yeah.
Right, 2 minutes, and then I'm going to wrap us up. Duncan, Emma and Simon, is there a requirement to do pre-screening before people return, and is it a good idea to take a staff temperature upon arrival?
Temperature. So I have been to an IRL event today, an in real life event that was a work event and not a Mills and Reeve one, and we were all screened on arrival. We all had a temperature taken before we were allowed to attend. It was an outdoor event, and you know, no one had any difficulty with that. No one had a temperature or was sent home, and you know, it is. And I saw at the osteopath yesterday, likewise, people had their temperature taken before they were allowed in. So lots of people are doing it. Again, Jagvinder's seminar will talk all about the data protection implications, etc., of that. But you know, in my view, you might consider it as part of your measures. Equally, it's not just about the temperature; it's around other symptoms. So you know, I think in my view, it's probably sufficient to tell staff, you know, not to attend if they have a temperature, if they have a cough, if they have any of the symptoms.
Yeah. Which is exactly what we've done, Duncan, in our guidance for returning to the office. We've just, if you feel at all ill or have any symptoms, then do not turn up at the office.
So I think that seems to be sufficient in terms of advising people that, rather. So I don't think it's a requirement, but equally, if you know, if it's reasonably practicable to do screening or temperature, no one's going to prevent you.
Yeah.
But you be careful what you do with the data.
Yeah, and staggered times for people on arrival if you're going to go through.
Yeah. So some of the sports, obviously, some of the elite sportsmen went back before. So certainly with some of the sports clients we've dealt with, they were doing full-on screening for sports people, but of course they were going into an environment where they couldn't or weren't maintaining social distancing. So the screening was sort of part and parcel of the, you know, because, you know, people weren't keeping that distance on the when cycling around the velodrome and things.
It's a bit difficult to tackle somebody from 2 meters and stay at 2 meters, perhaps.
Celebrate a wicket.
It's all about cricket for you, Duncan.
But no saliva.
Okay, I don't know the answer to, can employers be obliged to pay homeworkers the monthly HMRC or homeworking allowance? I suspect not, I think I have to say, but there we are. Right, I'm going to say at 4:28, thank you, everybody. How do we do? Please let us know at the usual address. It's lovely to hear from you. We'll keep it open so you can just type up your answers if you'd like to. Sorry, we didn't answer all of the queries, but most of them. I'd like to say thank you in particular to Patrick for sharing his insight on how Mills and Reeve are dealing with and looking to the future on working back in the office. Really looking forward to getting back to my sit-stand desk. I'm a massive advocate of that. I have got 2 screens, but boy,
I'm waiting for Patrick to post me one time.
If there are any other questions or anything anybody wants my opinion on something, then by all means use my email address at Mills and Reeve, and I'm quite happy to answer questions or take a phone call just to discuss stuff.
Patrick.phipps with 2 P's at mills-reeve.com. Thank you to Duncan for coming back from his ILR event, whatever it was, with his yellow wristband.
Right.
There you go. Woohoo! To show
temperature is normal.
Temperature is normal. Thank you, everybody, for staying with us. The majority of you did. We've lost a few people towards the end. I hope you found it appreciative. Somebody says, great webinar. Thank you, Simon. Super helpful. Thanks.
Thank you. Brilliant.
Simon. Brilliant. Thank you very much. 2 more webinars. We've announced one of them. So Jagvinder King, who is going to be talking about data protection, avoiding pandemic pitfalls in the workplace, which is not easy to say. That's on the 5th of August, again, free, 10:30 in the morning. And we've also got a wellbeing one, which is all about returning to the workplace and the wellbeing, which is wider than what we've been talking about. And that's on the 12th of August, and that's at 11 to 11:45. And that's with our HR director, Sandy, and others. I'm going to say thank you, everybody. Have a great day. Go out and enjoy the sunshine. It's going to be really hot tomorrow. So make sure that you go into the office and use the air conditioning if you've got it.
Always wear sunscreen, as the song says.
Yeah, but we didn't touch on air conditioning and whether that spreads the virus, but that's a whole other thing.
That's a whole
Yeah.
different kettle of fish.
So who say there's no evidence at present, other than in laboratory conditions?
Yeah.
Okay. Good stuff.
Brilliant.
Thank you, everyone. Take care.
Thank
Bye-bye.
you. Thank you. Thank you. Bye-bye.
Bye.